Musa Garba, not his real name, works as a security guard at this house in Jos. He relocated to the city after his home in Borno State, the epicenter of an insurgency, was destroyed by militant attacks, which killed 4 of his relatives.
The situation affects me from time to time. I work here as a security man, and sometimes I just get scared that I may get attacked, just the way some of my relatives were attacked and they lost their lives. Sometimes it just feels like I am getting out of my mind. We've heard severally that the government is tackling insecurity and making everywhere safe, but we keep having attacks on innocent people.
In Nigeria, data on PTSD isn't easy to come by, but in 2023, the WHO estimated that 40 million Nigerians are affected by various forms of mental illness, including depression. Exposure to conflict, displacement and unemployment are some of the factors associated with it.
Some of the things that you see in an individual experiencing PTSD is like reliving the experience. So like they experience the situation as though they are still stuck in it. So the brain has not moved past it. Another thing is avoidance. They tend to avoid things that might trigger reliving that experience, right? Another thing is like it distorts, of course, everyday life functioning. Like they're not able to carry on with life the way they should because there's interference.
According to the UN Refugee Agency, over 3 million people have been displaced in Nigeria due to the insurgency, which began in 2009, and other forms of conflict such as land disputes between farmers and cattle herders. Mental health experts are calling on the government to offer more help.
Make help and treatment accessible, awareness, and creating the platform for people to not only get help but thrive. Some of the global indices that poses a barrier to help-seeking behavior, especially around mental health. A leading factor is stigma, and especially within our context where we have like certain cultural practices that abhors speaking out, either because you might be perceived as weak or it attracts certain labels or might predispose you to shame, And another thing is that the cost of accessing help it's really, really high.
The government says it is evolving better strategies to tackle insecurity and ensure that people living in camps are resettled in their communities or provided alternative safe places as well as jobs for the unemployed. The government says it is also expanding mental health care and providing psychosocial support to populations affected by insurgency and other forms of conflict through collaboration with the International Organization for Migration and other organizations. However, many people like Musa Garba are left with heavy hearts, disappointed that it may take a while before the mental health challenge in the country is addressed. Tassim Akendi, CGTN Jos.